am Jyoti Kumari, Assistant Professor in RPIIT campus. So today we are going to learn about the blood transfusion reactions. Blood transfusion reaction. They have two basic principles observed for the blood transfusion are first one, the donation must be harmless to the donor. The donated must not be harmful to the patient or the recipient. In fact, it must be beneficial to the patient. Following are the some of the criteria accepted for the selected of the donor. Age should be in between 18 to 60 years. Hemoglobin should not less than be 12.5 gram per dl. Interval between donations should be minimum 16 weeks, at least 3 months. Pulse rate should be regular and in between 70 to 100 per minute. Accepted blood pressure systolic between 50 to 100 mercury. Temperature of the donor should be normal and there should be absence of any chronic disease. The donor is rejected in the case of the following things: if there is history of viral hepatitis or AIDS, if there is history of malaria within last 3 years, if the patient has received immunization against rabies and mumps, smallpox, rubella, etc. within 2 months, if the donor has undergoes dental surgery within 72 hours. Questions regarding asked regarding the following are asked to protect the donor. Time span since last blood donation, medication, history of certain clinical conditions such as heart disease, bleeding disorder, diabetes mellitus, fainting, etc., menstruation and pregnancy. Questions regarding to the following are asked to the donor to protect the recipient. History of the hepatitis, exposure to virus hepatitis, history of self-injected drug abuse, transfusion of blood and components in the last 6 months, recent immunization or vaccination, exposure to the infectious disease in past 3 months, history of malaria and history of malignancy also. Physical examination of the donor, blood pressure examination and examination of the pulse for rate and tone check irregularities, examination of conjunctiva or oral cavity, checking of body temperature, examination of respiratory, cardiovascular and nervous system, collection of blood from donor, basic requirements. Before the collection of blood, it is necessary to fill a form which includes the following data of the donor: name, age, sex, that is gender, address, date of the donation should be mentioned, consent of the donor of blood donation, signature of the donor. Blood collection room should be preferably air conditioned, with adequate lighting, with clean floors, with adequately cushioned beds or tables attached with the armrest, with a bedside intravenous drip stand should be there, with a medicine box containing emergency drugs into it. Types of container used for the blood collection. They should be disposable plastic bags. The plastic bags of 350 ml collection of blood. 350 ml will be blood in the 350 ml of plastic bag, and 49 ml of anticoagulant will be in the 350 ml of plastic bag. And plastic bag of 450 ml, it will have 450 ml of blood and 63 ml of anticoagulant. Now they are the instruction to the donor after blood donation. If donor feels dizzy, he should be asked to lie down. The donor should not smoke for after half an hour after blood donation. The donor should not consume alcohol till he has eaten a meal. The donor should increase fluids consumption for next 12 hours. The donor should be asked to eat well. The donor should not perform any heavy work until he has eaten substantial meal. Following are the are of the some common reactions that are encountered in the case of donor after blood collection. Vomiting, neurogenic shock, local reaction, hematoma and pain in the vein puncture site. The blood transfusion reactions. Blood collection for transfusion can produce following hazardous reaction, if it is not properly screened, typed and cross-matched. Immunological reactions due to red cell incompatibility, white cell incompatibility, platelet incompatibility and plasma incompatibility. Immunological transfusion reactions can manifest as chills or fever in its simplest form to life-threatening complications like hemolytic reactions. Simple non-hemolytic immunological reactions. Thank you.